Oftentimes in surgery, patients come into the operating room and ask, hey, what is all that equipment that they're looking at? They see lots of lights, buttons, sounds, and so we wanted to take just a few minutes to describe what some of the equipment that we use does and why it's necessary in surgery. So for example, to my left here is an anesthesia machine. This is basically an intricate ventilator that allows us to maintain anesthetic administration throughout surgical procedures. Not only does it allow us to administer anesthesia, but it actually allows us to breathe for the patients when necessary and also monitor parameters related to patients' ventilatory status and cardiopulmonary status throughout the surgical procedure. On these machines, you see lots of buttons and knobs. These devices here are actually what are called vaporizers. So these are devices that actually deliver anesthetic gases. Oftentimes patients ask, hey, how do you know I'm going to be asleep during surgery? Well, you spend quite a few years learning how to do that, but also these machines allow us to do that. So anesthesia is not a one-dose-fits-all scenario. When we administer anesthesia, it's actually continuously administered throughout surgery. And so these devices allow us to do that. You also notice that there's quite a bit of monitoring that goes on for the patient that allows us to see the method, the rate, and the size of breaths that patients are taking during surgery, and vital signs monitors that allow us to monitor multiple vital signs throughout surgery continuously. One statement that patients make as they enter the operating room is, why is it so cold in here? And that's actually a really good question. It's quite uncomfortable in here for most people, including myself, oftentimes for longer surgeries. But there's a couple reasons for that. The rate of infection decreases when you're able to keep the temperature down. So you have less humidity, less temperature, less chance for bacterial growth and proliferation. The second reason is comfort. The surgeons are underneath surgical lights and gowns, gloves, masks, and caps, and it gets quite warm in surgery. A third reason is it's actually pretty drafty in these rooms. They have what's called laminar flow, which means the air flows from the top of the room to the bottom and then out the corners of the room. And that's to maintain a certain circulatory pattern in the room. So if something does get caught up in the airstream, it's forced away from the patient and away from the surgical field. And so all those things add up to a pretty cold environment. One of the other things that's fairly daunting to patients when they come into an operating room is large quantity of curious and foreboding equipment is the comments that we often hear made. And so if you look to my right here, you'll see what we call an OR boom, which is a large device that houses multiple pieces of equipment. On this boom, there's actually devices used for multiple types of surgery. So you have devices like this one here, which is what's called a laparoscopic insufflator. If you've ever heard of the term minimally invasive surgery, this is a device that is used to actually allow the performance of that type of surgery. Another device that you see on this boom is a Bovie machine, or what we call an ESU, electrosurgical unit, or electrocautery. That's a device that's been used for many years in surgery to minimize bleeding. It used to be in surgery that scalpels were used almost exclusively. Nowadays, we have electronic and electrical devices that actually allow us to make incisions while minimizing blood loss. And so that's actually what that machine does. The machine just above it is actually a smoke evacuator. So that keeps the surgical field clear of any smoke that might be caused from electrosurgical device. So as you can see, there's many devices on here. We have screens that are used for minimally invasive surgery. So when you're operating through a small port, you're actually looking at the image that's probably 2 or 3 inches in diameter in real life, actually 32 inches across. So that allows the surgeons to see detail that would otherwise not be able to be visualized in a normal setting.